Well, it's something that a parent or a caregiver never wants to encounter, a young baby or a child choking.
Yeah, knowing how to dislodge whatever it is blocking the airways can, of course, save the child's life. For Good Growing today, we sent Tim Robinson to Children's Hospital to find out exactly what you have to do. And as you showed us before the break, Tim, it's amazing the things that can actually get lodged in a child's throat.
Yeah, it really is, Brad and Joyce. It's kind of scary. And I've been talking this morning with Dr. Rich Molteni. He's the medical director here at Children's Hospital. And Doctor, when we've been talking, some sobering statistics you've been telling me about. First of all, that statistic about the children from 0 to 1 years old, they're pretty vulnerable.
They're very vulnerable, and particularly vulnerable in terms of the need for resuscitation coming to the hospital, and they're a high risk of the group of children who die. So those are the ones we really should concentrate our energy on today.
And today we are going to show you some tips, moms and dads and grandmas and grandpas and caregivers, anybody, about what to do if your child chokes. And let's show some of the things that, these are actual items that have been recovered from children's throats.
From their throats, from their ears, from their noses, but today, most importantly, from their airway. So at their vocal cords or below their vocal cords, these are of sizes that you can see in some small infants may not fit. In others are absolutely going to totally obstruct that airway. That is, there will be no air that could get in or out. You'll hear no sounds, and those are the children who absolutely need your help at that moment.
And this, you say, is usually found in the throats of children older than a year, maybe a year and a half and up.
Correct. Correct. More often in a child under a year, it's going to be food, and food particles tend to be the most common.
And let's go over some tips for parents. Let's show you some tips that we have about food, because this is important for you to know. I believe we have it here. Cut food in bite-sized pieces, cook or mash or grate the hard foods, steam the vegetables, make sure the baby's mouth is clear before you feed them the next bite. Always feed the child in a high chair. Don't let them run around. And don't feed your child while the little kid is laughing or crying, I suppose. So
that's correct. Kids under 2, make sure you avoid those peanuts, grapes, popcorns, things that really can be easily aspirated. Don't let them play with balloons.
Right. Good advice there. Now, let's talk about the children a year and younger. That's what this baby, this model represents, is a child a year and younger. Let's say that, you know, there's some bad situation going, your child's choking. What do you do?
Well, first of all, if you can hear the child crying and coughing, trying to get that out of their airway, let them do that. Don't try to shake them. Don't try to move them. Let them cry.
So let their body naturally try and take care of it.
Exactly. The worst thing we can do is get involved. As soon as, however, the child looks like they're having more difficulty breathing and or you can't hear them, that is, there's no air movement, you can't hear a sound, they're not, that's when we need to
That's when you have to take action and do something. And you said you sit down with this, actually.
Yes, this, I mean, you can imagine how hard it is to try to do all this while you're with a child that may be wiggling. So you want to be seated when you do this. You want to support the child's neck and throat. You want to put the child over on your knee, like this, supporting the child head over your knee. Remove the shirt so you can see the child's back and the shoulder blades. And right between those shoulder blades, you're going to give the child 6 very quick and quite significant thrusts with the heel of your hand. 1, 2, 3, 4, 5, 6.
And is that how hard?
That's how hard.
Okay.
It's scary, but that's how hard.
And hopefully, if that works, something will dislodge and you'll be done with it?
It'll be dislodged. You'll hear the child cry again. If you hear the child cry again, you have dislodged it.
And if that doesn't work, then what do you do?
And if that doesn't work, the child's still distressed, still not breathing, hand on the back, flip the child back over, still on your knee, support the child's head over your knee again, move the shirt up. Now you can see the nipple line, and you put 2 fingers just below the nipple line in the middle of the chest, and now we're going to do 6 chest thrusts. 1, 2, 3, 4, 5, 6. And that hard.
And if that doesn't work...
If that doesn't work, it's time to call 911, and we're going to move to cardiopulmonary resuscitation.
All right, doctor. Let me just, real quickly, we don't have much time left. This is a model that is representing a child from 1 year on up to adulthood. You do the same thing, basically the Heimlich maneuver.
It's the Heimlich maneuver. We don't use that on these babies because their liver comes low. We could really damage that. Over 1 year of age, we'll do a Heimlich maneuver, make sure the head is straight, stand at the child's foot or sit on the knees, This time you use the heel of your hand. This is where the chest wall meets. There's a little piece of bone that comes down here. So between the belly button and this bone, you put the heel of your hand, put your other hand on top of that, and now you do 6 thrusts up toward the throat.
And hopefully at some point in there, something will dislodge.
And that's exactly what we're going to accomplish.
All right.
We're
Well,
going to do
Doctor,
that.
this is just terrific advice. We really appreciate it. Dr. Rich Molteni here at Children's Hospital. Great advice for parents to remember. And we do have a link on our website, I know, with some of these tips. Brad and Joyce, it can be a very scary situation, as I'm sure any parent knows, if something like this happens.
Absolutely.
Thanks, Dr. Molteni.
My
Appreciate
pleasure.
it.
Thank
Great
you.
refresher course there.
Yeah, I'll say.
Yeah.
Because you have to take action. Tim, thank you.
Okay, guys.
Well, other health news.